All right, so this is one of the most undiagnosed disorders that we have going on, unfortunately, and it's the unstable pelvis. So many people have lower back problems, disc problems, sciatica, because they have an unstable pelvis, but it goes either undiagnosed or misdiagnosed. So we're going to talk about that. But first and foremost, you need to understand, to diagnose an unstable pelvis, two really main things needs to happen. Number one is we need to lay the patient prone. We need to approximate the hips. And if that actually takes the pain away or makes it worse, we know we have an unstable pelvis. Next, if we look at the x-rays and we see that the SI joints are white or inflamed, that means they're hot, that means they're inflamed, that means they're unstable and they're working way too hard, and the lower back, again, is gonna suffer because it has to work doubly as hard to compensate for that unstable pelvis. So the first thing that we're gonna do, and this is ideal, is to wear a trochanter support, all right? Now this trochanter support, you're only gonna wear for about 2 to 3 weeks while we're stabilizing the pelvis. Now what that looks like, if we don't understand, these SI joints, where the sacrum or the tailbone attaches to your hip bones, all right? There is no muscle that runs across this area, so this should be a perfect joint. So the reason why it's not is because it wears out and it becomes unstable, and these joints right here become extremely inflamed. All right, so what we want to do is, when it opens up, they become inflamed. So what we want to do is approximate the hips by wearing this trochanter support and tightening for about 2 to 3 weeks so that we can stabilize this pelvis. Then we can start to work on the lower back once the pelvis is stable, all right? So let's demonstrate how to put this on, this trochanter support. I'll have you stand up, and it's just like putting on a belt. Now, we don't want to put it on above the hips. So the iliac crests, or the hip bones right here, I can just kind of reach in and I can feel the tops of hers. I want to come down about 1 inch, and that's where I want to put the trochanter support, okay? So let me demonstrate here. 1 inch over, and again, we want to make this pretty tight, and that's the primary strap right there. Now there's 2 secondary straps on the side, and we're gonna make that as tight as we can and as secure as we can, and then there we go. And it's as simple as that. So when she's wearing this, it's only appropriate when she's standing or moving around, basically when she's erect. So when she sits, let's say you have a desk job, what do we do to stabilize the pelvis? Because a lot of the time, a lot of people with desk jobs sitting a lot, that creates that unstable pelvis. So what do? Well, let me show you. First, to take that off, obviously put that at the sides, and there you go. So when we're sitting, real simple, we're gonna turn the chair around, and she's gonna sit just like a cowgirl or a cowboy with opening the knees. Now what that opening the knees is gonna do is, again, it's gonna approximate the hips. And again, you're only gonna need to do this for 2 to 3 weeks. And if anybody asks you at work, why in the world are you sitting like this? You can explain it to them, because I tell you what, you're probably not the only one. So this is ideal when you're sitting for 2 to 3 weeks to stabilize the pelvis. Really, really big. All right, the next thing is, you have to understand, yeah, you can stand up. When we are working with the pelvis, we're working with the lower extremities. So your pelvis does not work in a vacuum. It affects everything down the lower extremity chain, all right? So we also need to work with a couple of different areas. First is we need to work with the calf muscle, all right? Especially we're talking about the soleus muscle, because the soleus muscle right here is like the shunt. It pumps blood to the ankle and the foot. So if we have an unstable pelvis, most likely we have a mechanical issue, and a lot of times what happens is we're not getting the proper circulation down into the foot. So what she's gonna do is, like she's demonstrating, putting her toes up on a block, a brick, whatever you have, and then she's gonna push her knee forward. Now, if you take a look, we want her knee to be directly over her toe, which it is. That means functionally this is completely appropriate, and she has ideal function, and she's getting that blood flowing through the ankle and the foot. You can relax. Now, if she can only go a little bit, like right here, that means we really have a problem going on, a dysfunctional problem, and we really need to start incorporating this stretch, not just daily, but 2 to 3 times, so that we can, again, start to open up the soleus muscle and start to get the proper blood flow to the lower extremities, okay? The last exercise that's ideal to work on when we have an unstable pelvis is the Kegel exercises. Now, it's not something that we can really demonstrate, but it's simply this. If you're a male or you're a female, just think about when you are having to pee really bad and you squeeze those muscles to make sure that you didn't pee. That is a Kegel exercise. You're gonna hold that for 5 seconds, do it 10 times, and that's the therapy. Simple stuff. So if you have an unstable pelvis, these 4 exercises are ideal. And again, you're only gonna do them for about 2 or 3 weeks to stabilize the pelvis. Then once it's stable, then we can start working with the lower back, and that's gonna, again, be the best therapy that you can possibly imagine to help with that lower back pain.